मालती मालती अरे बाप रे वर्क hello sir, good evening.
Hello Vijay, back home?
Just about to sir, tell me.
You were great at the meeting today. The Raheja contract is on the verge of getting sealed.
Okay.
You proved yourself, Vijay.
Thank you sir, thanks a lot. It's a pleasure working under you sir, thank you.
What about a small treat for that?
Pardon me sir?
I mean, a treating news to gift you with. You have just been promoted as the new zonal head. How is that?
Sir, sir, is it true sir? I mean I really can't believe it sir.
You mean you're asking me is it early, right? Don't worry, young man. It's not too early. The local officers will report to you directly now. I will brief you everything in detail tomorrow. Meet me early in the morning.
Sir, thank you sir. I really can't believe it sir. Thanks a lot. Thanks a lot for this.
Vijay, you've always been a hardworking and dedicated employee. It's tough to get people like you nowadays. Keep them. Where is the house party?
She's really doing good sir. Thank you sir. Thank you once again.
Dad, take care.
Thank you sir. Thanks a lot. Malti! Malti! Malti!
Vijay? 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 Hey Vijay, what exactly is the matter with you? I've been calling you nearly 100 times for now and you're not even answering. Okay, now what does your mean? Huh? What is wrong with you, Vijay? Is it something in your office?
No. Nothing.
Are you sure? Just look at this cup of tea, Vijay. It's been lying here since an hour. At this time of the day, you go for a walk and you're just sitting here doing nothing. What is happening, Vijay? Please talk. Vijay. Vijay. See, I've been noticing you since the past 2 weeks. You're just absent-minded, sitting here all the time, not wanting to work, not even talking to me properly. What is it?
What do you think I've done, Malti? What do you think I've done in life?
Oh my god. What are you even talking about, Vijay? 4 months ago, you got promoted to the position of a zonal head. We have no money worries, a great family, having a good health. You were even talking about planning a trip after 2 weeks. And now what is all this, Vijay? What are you talking about? Is everything okay? Are your parents fine?
Everyone is fine, Malti. Everything is fine. Except me.
Come on, Vijay. Please, don't do this. Don't do this to yourself. Why are you just suffering on your own? Tell me what it is, Vijay. Tell me. Don't you think I have the right to know what is really bothering you? Tell me, Vijay.
Nothing is going to be alright.
Vijay? Hey Vijay. Hey dude, someone is in your room.
Tell me.
Busy thinking about your wife. Oh, new coffee mug for our new zonal head. Tell me dude, what about party tonight? It's going to be damn good. Is Malti coming along with us?
I'm not coming anywhere. Please, leave me.
What?
I'm busy, I'm not coming.
Are you joking? This party is for you. You are our new zonal head. Everybody will wait.
Stop it. Stop it. I'm not any zonal head. I'm not coming for any party. Please leave me alone.
Vijay? You're just sitting here. You didn't go for office today. Are you okay? Vijay?
No, I'm fine.
What is the problem, Vijay? Tell me.
Nothing, Malti.
Enough of your yes, no and nothing, okay? You are just sitting here all day long. Your boss and your friends have been calling me. What should I tell them, Vijay? See, I'm getting very worried. I'm reaching my wit's end now. Please tell me what it is. How can we help you? Talk, Vijay.
Can you help me with one thing? I want to just leave everything and go.
What are you saying, Vijay?
Can you help me with that?
What are you saying? Vijay.
Life is just meaningless, Marti. Just meaningless.
Vijay, look here. See, I've been seeing you sobbing like this, hiding away from me. What is the matter? You're not even talking to your friends and your boss. I'm very worried, Vijay. I don't know what it is, but I think we need to see a doctor soon.
That's not going to help, Marti.
Let me handle this.
No, it's not going to help.
Yeah. Can you please send Mr. Vijay? Thank you. Please come in.
Good morning, sir.
Good morning.
Vijay, please come. Good morning, doctor. My name is Mrs. Marti and he's my husband, Vijay.
Please have a seat.
So this is the letter given by our family physician, Dr. Gupta. Vijay has been behaving very strangely over the past few days. I really don't know what to do about it. We're just very, very confused. That's why we have come here. I don't know what is wrong with him.
Don't worry, madam. We'll try to see how I can help you. How are you doing, Mr. Vijay?
Not well, doctor. Really not doing well. Everything around me is bothering me, doctor. Everything around my life is actually bothering me. I don't know what to tell.
Doctor, this is the way he keeps talking all the time. Just in these negative tones. I've started to feel really scared now. I don't know what to do, doctor.
No one can help me, doctor. She's just telling me no one can actually help me. I know that my life has become a waste.
Okay. So, how long has he been having these problems?
For the past few weeks, and that I'm seeing Vijay, he's not talking at all. He just sits in one corner of the house all alone, not talking to his colleagues. He's not going for work. Trust me, doctor, there is apparently nothing in our life to be worried about. Everything is all fine. But he just doesn't want to talk. I'm really worried. I don't know what is wrong with him.
So you can take these tablets in the night. Just one tablet per night for the coming 15 days. And you meet me after a couple of weeks.
Okay. But doctor, in how many days will he be completely alright and just the way he was before?
It will be difficult for me to predict the exact time frame, but he will definitely be better with these medicines. What, Mr. Vijay? Will you take these medicines?
Nothing will help, doctor. All this is not needed.
I know, Vijay, that you are having a tough time, but it's a phase and it will go. Please let us help you.
Doctor, why is this happening to him? Why is he suffering so much?
Madam, Vijay is suffering from.
There's something called as a major depressive disorder. It is an illness, just like, say, high blood pressure or sugar or thyroid problems. It can just about happen to anybody. And just like the other illnesses, this also has treatment.
Doctor, do you see other patients also who suffer from such an illness?
Quite a lot. Almost 1/3 of the patients that I see in my OPD are suffering from major depressive disorder. And quite a lot of them improve with treatment.
But doctor, why is he so sad?
It's not just about sadness alone now, but there are other symptoms as well in this particular disease, like having negative thoughts, feeling sad about life.
Nothing is required, nothing. Doctor is just a waste of time. I don't need it.
Just please keep quiet. Vijay, let me handle this. Please, we come to a doctor, please.
I request both of you to just relax right now. Right? Anger is not going to solve the issue. Now, Vijay, what you're going through is a phase. It's called as a depressive phase. And these particular medicines will actually help you get better. But I would require some time to help you out for this. Would you please give us some time? But in the meanwhile, I would be very happy to listen to your concerns, Vijay. Anything that you would like to share?
I don't know, doctor. Nothing is helping me. I don't feel interested in anything. Not even my family. I'm not liking anything these days. How will I like the situation? You tell me.
Will these medications at least help him? I can't continue to see him like this.
These medicines will definitely help him. And I believe that it will take some time for it. So you please start taking these medicines. And then we'll see how he is responding to it after 2 weeks or so.
Mr. Vijay, in the meanwhile, please do take good care of yourself and you shall get well soon. Alright?
Thank you, doctor.
Yeah. Thank you.
No point in living. No point in this life. I don't have any interest in this. All this family, this money. No point in living. God, take my life away. This is seriously useless. Why should I be alive?
Vijay.
Why can't the people just leave me alone? Just allow me to die in peace. That's all I want.
Look, doctor, he always keeps talking like this. Always talking of ending his life. I'm really worried, doctor. I don't know what to do.
Has he tried anything like that?
Good God, he hasn't. I have been vigilant always. Have to keep watching him throughout the day. Doctor, yesterday he was talking of running into a vehicle. What has happened to him, doctor?
Vijay, is it true that you have been feeling suicidal?
Yes. Too much.
It seems that the medicines are taking some time to have its effect. It also seems that Vijay is constantly having thoughts about dying and he's also thinking about killing himself. He's also voiced some plans that he has made. I think, ma'am, that we cannot afford to just stick on to this line of treatment alone. We can consider other treatment options available to help Vijay get better. And this is where I think that there is an option called as electroconvulsive.
Doctor, does that basically mean shock treatment? No, doctor, please. We don't want that. His brain will be damaged and he will be in too much of a pain. No, doctor, I can't see him like that. I think we'll give him just medicines, doctor.
I can understand your anxiety. So probably when I use the term electroconvulsive therapy, you would have had the vision of 4 people holding Vijay on all 4 sides, somebody gagging him and somebody forcibly giving current to him while he shouts and screams. Is that what you imagine?
Yes, doctor.
Sadly, ma'am, that is the way that most people imagine electroconvulsive therapy to be. But if you can give me around 5 minutes of your time, I would like you to listen to me as I explain to you about electroconvulsive therapy, some of the pros and cons of electroconvulsive therapy, and some of the myths and misconceptions. Afterwards, of course, you can take a call on whether to go ahead with it or not.
Sure, doctor. Definitely.
Thank you, ma'am, for your permission to go ahead with this. So, basically, electroconvulsive therapy is not offered for all patients. It is offered for patients who have severe form of an illness or who have illness out of which they need to come quickly out of. This is happening under expert supervision at all times after the patient is admitted. And at all points of time, each step of the process will be explained to you. As I'm explaining it to you now, even after admission, we will be explaining to you each step of the process. There will be a multidisciplinary team involved in this, right? So, team involving psychiatrists, anesthesiologists, who would first assess the fitness for Vijay to actually undergo ECT. And provided that he is fit and both of you have decided to go ahead with this treatment, then we will be giving a very, very low dose current after he is anesthetized and after he is relaxed under the supervision of an anesthetist, and then it will be enough current to just bring him out of the illness and not more of that, and then it will be given in cycles, say on alternate days, around 6 to 8 sessions, and we will be there throughout watching him as he comes out of the anesthesia, and then we will be guiding you through the process as to how it is improving.
But does it work, doctor?
Almost always. It's in fact one of the most efficacious treatments available, and it is needed in Vijay's case, I opine, because he is expressing constant negative thoughts and thoughts about dying and suicide. Before any untoward incident happens, that we should actually take the necessary steps to prevent that from happening, and I think we should intervene right now. And in my opinion, ECT can be a very good modality of choice for Vijay. However, the call is yours, both Vijay and yours. This is just my opinion, and this I offer to you. The choice to go ahead with it or not lies with you.
But doctor, are there any side effects?
All medications, all treatment options have side effects, and so does ECT. And as compared to the side effects, however, we should actually kind of understand the benefits that ECT can give, right? So at this point of time, the benefits that we reap out of ECT would be far more than the side effects that Vijay might be having out of ECT. Side effects can be something like headache, that is very brief after ECT is given, so for which we might give a small dose of, say, paracetamol. And then there can be other side effects like small memory losses.
Memory? Doctor, do you mean he will forget everything?
No, I didn't mean that. Let me just clarify that for you. What I meant by memory loss is that on the days that ECTs are given, there is a chance that Vijay might actually forget what has happened on that particular day or a few hours before that particular day. And this is transient. None of the older memories will be affected, rest assured. And in fact, a few days to a couple of weeks after the ECT is stopped, he will regain all of the memories that he had lost. So there will be no sort of a permanent memory loss as you would have feared.
Okay. But doctor, what if we start off the treatment and then we decide to change our mind? Can we do that?
Absolutely. Once you sign for an ECT, it doesn't mean that you have to undergo all the sessions of ECT. You can choose to withdraw your consent at any point of time. After the ECT is given or even before the ECT, you can choose to withdraw your consent. And it is not a one-time consent, but it is a consent that you can periodically revise based on your decision.
I don't know, doctor. I'm feeling very confused. Don't know what to do.
I can understand your ambivalence right now, man. So what I would suggest you do is, you can think about this while Vijay is continuing to be on medicines. Continue to keep a very strict vigil on him and continue to have an eye on him so that he doesn't commit anything serious. Let him continue the medicines as well. And I will also give you this booklet that we have prepared on ECT. Right? It will give you a very comprehensive information about the details of what ECT is, how it works, and what are the common side effects, what are the myths and misconceptions about ECT. And it will actually clear a lot of your doubts about ECT. You can go through the same. And in case you have some doubts at the end of it, after going it through, my number is listed below. You can always get back to me and I will be happy to clarify the doubts for you.
Okay. But why not just take medicines, doctor?
If this particular medicine treatment was working, then we wouldn't have considered the treatment option of ECT. But considering that he's talking about thoughts of killing himself and having constant negative thoughts about dying, I think that this particular treatment option is something that you can consider. So the choice is yours and choice is also Vijay's. So Vijay, what do you think about ECTs?
Nothing can make me better, doctor. I'm just making my life a waste and I'm wasting hers also. Do whatever you want to.
Don't worry, Vijay. We'll definitely try to help you out. And so what I would suggest is You take this booklet with you, go through it completely, get back to me if you have any doubts.
Yeah.
Frankly speaking, I'm very confused at this point, doctor. I really don't know what to do. I think I need to discuss this with his parents and take their opinion also. Thanks a lot for the information, anyways. I think we'll go for medicines at this point of time, and I'll get back to you at the earliest.
You can get back to me anytime, ma'am. Right?
Yes.
Alright, Mr. Vijay. So take care of yourself and I'll see you soon. Right? Good day.
Thank you, doctor.
Thank you.